recording us started. Welcome everyone. I wanted to welcome everyone to our patient and public engagement lunchtime learning session. Both everyone in the room, but also we are coming to you via webinar as well. So welcome everyone who's joining us via webinar. My name is Carolyn Shimon. I work here at the George and Fahey Center for Healthcare Innovation, and I work in the area of patient and public engagement. And today's session, we're going to be talking a little bit about recruitment and engagement. First of all, I'd like to do some acknowledgements to start off with that we are gathered here today on Treaty 1 land, home of the Anishinaabe, Cree, Oji, Cree, Dakota, and Dene peoples, and homeland of the Métis Nation. And in coming together today, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in the spirit of reconciliation and collaboration. And in talking about things like patient, community, and public engagement, in health research, we have to, in fact, recognize that Indigenous research methodologies are some of the most at the forefront as far, and look to Indigenous scholars, communities, and researchers in this area as well. Today's agenda. So we are going to briefly talk about, just so we're all on the same page for those who have come to previous ones, but also for those who are new to our lunchtime learning session. We're just going to talk briefly about what is patient-oriented research. We're going to talk about what is patient engagement in health research, levels of engagement, and then we're going to get into recruitment. So thinking about our purpose, our methods, our motivations, our partners, and some tips and tricks around there. So disclosures, because we are accredited, I'm employed by the George and Fahey Center for Healthcare Innovation, as I stated before. So, first of all, oftentimes the question is, what is patient-oriented research? And the Center for Healthcare Innovation is actually part of the Strategy for Patient-Oriented Research, which the acronym is SPORE, and we're the Manitoba Support Unit. And SPORE defines patient-oriented research as it's seen as a continuum of research that encompasses 5 elements. The first is that it engages patients as partners. The second is that it focuses on patient-identified priorities. Third, improves patient outcomes. Fourth, is conducted by multidisciplinary teams in the partnership with relevant stakeholders. And fifth, last but not least, aims to apply the knowledge generated to improve healthcare systems and practices. Now, if you notice, I capitalized and underlined "and," because oftentimes I'll have health research say to me, well, I do patient-oriented research. I do research that improves patient outcomes. And that's awesome. But a lot of health research could encompass this. When we talk about patient-oriented research, we also want to talk about engaging patients as partners, focusing on patient-identified priorities. The multidisciplinary teams that involve policymakers, healthcare decision makers, and patient partners, as well as making sure that the knowledge that's being generated works towards improving healthcare systems in practice. So all of these elements are essential. Now, when we talk about engaging patients as partners or patient engagement in health research, again, SPORE defines it as the meaningful and active involvement of patients in the governance of research. So when we talk about governance, we mean having patient partners, people with experience on the steering committees, on the large governing bodies of the research project. We also want to have people involved in the priority setting of research, the conducting of research, so meaning involving people with lived experience in conducting research, and then also the knowledge translation of research. And Involve, which is a group out of the UK, which SPORE was modeled after. It's been around for a little bit longer. It defines public involvement as research that's carried out with or by members of the public rather than to, about, or for them. And for us, typically how I describe patient engagement when health researchers come to me is that it means people, informal caregivers, communities with lived experience of a health issue, having a it's right there. This wonderful photo we have the model in particular in attendance today. I'll sign out. So it's all about involving people in decision making about the research process, and that's how we differentiate between participants and partner. So there's a lot of different guiding principles that are involved in patient-public engagement. If you take a look at SCORE's framework and there's a lot of different frameworks and models, but some of the main ones that we see is inclusiveness. So integrating diverse patient and public perspectives and research that reflects those diverse contributions. Support for patients and public partners so that they can be able to fully contribute. And so that means creating safe environments, anti-oppressive and trauma-informed practice, making sure that there's training, education, and also compensation for people's time. Mutual respect and partnership. This means that the value of experiential knowledge is recognized by all team members. Co-building. So this is a huge one. Co-building. So making sure that public, patients, researchers, healthcare professionals, decision makers are working together from the beginning to identify problems and gaps, set priorities for research, collaboratively produce and implement solutions, which is very important. Co-learning, so having people with lived experience learning more about the research process, but also having researchers learn more about what it means to engage and build relationships with communities and people with lived experience. Reciprocal relationships need shared power in decision making, which makes us a little uncomfortable, right? But we want to address those things. Transparency, honesty, and trust. So open communication, critical reflexive practice, conflict resolution. All of these things are important. And in our next Lunchtime Learning series in December, we're going to move a little bit further into some of the areas that I like to talk about a lot, meaning trauma-informed practice, how do we engage, different perspectives, intersectionality, all of those pieces we'll be addressing then. We always have to be understanding and cognizant of the fact that look at that, I'm moving too fast. We have to be cognizant of the fact that sometimes how we define patient and public engagement may exclude certain individuals. So people who don't necessarily identify as patients because they are unable to access the healthcare system because of geography, so rural, urban, but also because of systemic barriers, thinking of racism, colonialism, sexism, transphobia, homophobia, ableism, saneism, all of these types of things, sizeism may affect people's access to care. And so when you're thinking about engaging and when you're thinking about recruiting, you need to think about how am I going to engage all of these different perspectives. Also, when you think about people who may not identify as patients because people living with mental health or substance use issues, taking up the label of patient may be also associated with a ton of stigma. Also, there are people who refuse to engage or prematurely exit because of unresponsive or disrespectful care. So you need to understand, how do I reach these people to engage as well, because their perspectives are incredibly valuable if you're looking to improve health systems or healthcare interventions. And then people living with disabilities oftentimes may feel continuously medicalized by the healthcare system and hence not really engage with that terminology around patients. So understanding how to engage all of these and being cognizant of it all the time when you're building your engagement strategy, when you're building your recruitment strategy. Why should I engage? I hope everybody here doesn't have to be convinced at this moment in time. But let's just quickly think about it. people with lived experience can help us identify research priorities that actually matter most to people who are living with the health issue that's being researched. So we've had tons of examples of this. There's one in arthritis, where researchers were like, the main priority of patient partners is pain management. They engaged a group of people. It was actually fatigue that was the number one priority. And so they had to change it. Helping to shape and clarify research questions so they reflect the needs and concerns of patients and informal caregivers. We've seen this a lot around engagement. Oftentimes, as researchers, we see things as problems to be addressed, but sometimes community members might want us to shift to strengths-based position. So there's been ones around mental health. Let's not talk about challenges and obstacles. Let's talk about ways to enhance the journey to recovery. Let's reframe the question so that it actually reflects, and in the end, actually, when you reframe and define the research question in a different way, you might actually get more people participating in your study afterwards. Helping ensure the methods proposed in your study are appropriate, accessible, and sensitive. So we've had tons of these examples where researchers may want to do, let's do a survey of people with chronic pain issues. And then when they engage patient partners, they go, what is this survey? They wanted to do a 100-question survey over the phone, and people said, if I'm living with chronic pain issues, you need to do this differently. You need to come and have tea with me. You need to have 3 or 4 questions. We need to have a conversation. And then that way they improve the amount of people wanting to actually participate in the study, because the methods being used actually are responsive to the way in which people live, work, and play. Helping make sure that outcomes have true meanings to the lives of patients. We've had different studies where the researchers, the outcome measures they really want to look at, say in a systematic review, are all one way, but then we engage with patient partners and find, yes, there are ones that we both agree on, but there are additional ones that researchers haven't even thought about because they don't have that lived experience. So adding those outcomes actually strengthens and enriches the research process in doing so. Making sure language and content of the information that's being provided to participants in the study is actually appropriate and accessible. So there have been times when we had patient partners look over the script of a clinical trial. So when people are approaching participants to see if the language is appropriate, the consent and the assent forms to make sure that they're actually very clear and that they address some of the concerns that maybe parents or patient partners might have. So there's great ways of involving people. And then, of course, this all helps increase participation in the study if things are spoken and exchanged in the right way. Co-developing ways to share the research findings. This is a great way. Why not talk to people with lived experience and patients about what will be the best way to communicate the research findings? What methods should we use? How should this information be shared? And then identifying what happens typically is you start engaging people with lived experience communities. You start getting more research questions that you may never have thought about before. And that can build your whole research program around what matters most to the community. Interpreting the findings, so many times we've had people help come up with themes and ways of seeing the findings. And of course, the transparency part of it all, making sure that research actually reflects the concerns and interests and that money and resources are being used efficiently. Most of you probably know the levels of engagement, but engagement exists on a spectrum from the lowest end at the consultation level all the way to the patient-directed level. At the consultation level, we're looking at obtaining feedback and input on a research decision. Researchers still maintain a lot of the decision-making power, different participatory approaches, whether it's focus groups or interviews or advisory groups, town halls, those types of things, are typically what you see at the consultation level. At the collaborate level, actively partnering together, shared decision-making across the board, patient partners sitting on research teams or participatory approaches like photo voice to I've seen digital storytelling, world cafes. These are all different ways of kind of collaboratively making decisions. At the patient and public directed level, we're talking about patients, public, community actively controlling, directing, and managing the research project. So all decision making with regard to the research process is being made by people with lived experience. Researchers' role in this type of research would be to provide support, to provide advice, training, or actually to carry out the research, but under the direction of the community. And those types of approaches typically use participatory decision-making and design and those types of things. We have a little online patient engagement map that you can. It's a tool that's online. It's free that you can access at our Center for Healthcare Innovation website, and it will allow you to look at every phase and stage of the research process, then decide what level you want to engage, and then choose different types of participatory approaches that might be interesting to you. And you can click on the participatory approach and it brings up a bunch of resources. We talked about this in our last one, but it's always the first step as you're developing your plan and as you're developing your recruitment approach too, doing an internal and external assessment. So first of all, as researchers, you need to start thinking about what is the minimum required level of engagement. So if you're applying for a grant for a CIHR score grant, you're going to have to engage at a collaborate level because the shared decision making, because that's kind of the requirement. So understanding first that, then to what extent does the team believe that engagement will improve the outcome of the research? It's good to have this conversation and get this understanding around there. What's the potential? So really, where can people with lived experience actually influence and have a say in decision making within the research process? Is it the research question, the outcomes, the design? Make sure you're very clear on this because this is what you're going to be communicating when you start to go for recruitment. What's the likelihood the research will fully consider patient input? So understand how flexible and adaptable are you? At what stage of the research process are you at? What if people with lived experience say, you're going the wrong way, this is where I think you need to be going? Are you open? How much change are you open to? Make sure you understand those things. And then what resources, because you're going to have to build a budget for patient engagement as well, so that you can compensate people and fully understand what you need to do. You also want to talk to people with lived experience, communities who you want to engage, talk to healthcare consumer organizations and groups that may engage with people with lived experience as well. Understand what the previous history of engagement has been. Has there been negative experiences of engagement in the past? How are you going to address that in your engagement strategy? How are you going to build relationships? I'm big on also understanding what inequities exist in relation to the health issue that you're looking at. So understanding who's affected differently, understanding who has different access to the healthcare system, and then figuring out which way you're going to engage in which participatory approach you want to use to be able to engage. And it might be multiple different types of participatory approaches to meet people where they're at. Understanding what some of the values and expectations of people living with the health issue that you're researching. So what's important to them? What motivates them? What do they want to see? What level do people expect to be engaged? This is a big one. So if your team's at the consultation level, we just want to obtain feedback, and your patient partners and people with lived experience want to be collaboratively engaged or bust, then you're going to have to find a way to move as a team towards the collaborative level. Or sometimes I've seen people start out at consultation level at one of the phases and stages of the research process and slowly move towards the collaborative level as that relationship and that trust begins to grow. And then how would people prefer to be engaged? It's okay to actually go out and ask people, how do you want to be engaged? Like, what do you see being your role in this study? What's the best way? We've had research projects where we said, okay, we're going to collaboratively, and we're going to have like big discussion groups. And then we engaged healthcare consumer organizations who were like, you're going to have to do one-on-one coffee talks. People are not going to want to do this huge discussion group. And so adjusting and figuring out ways to engage people where they're at and what they prefer and feel most safe and comfortable with. Now, when we talk about recruitment, first of all, a lot of times people are right away are like, okay, I need, a couple of people with diabetes, I need you to recruit them, put them on my team. But I want people to back up all the time and start off with, and some of those external and internal conversations are really helpful. First, before you think about who you want to involve, you should have a clear understanding of why you want to be engaging people. So this means going beyond simply, I just want people's feedback, to what patient and public engagement in your research project is meant to achieve. What is it meant to achieve? And then how can patient and public partners input actually contribute to the decision making in the research process? So being super clear on that will help you when you start to go out and recruit. Again, as I always bring it back to it, remember that engaging patients in the public and research teams often can inadvertently exclude certain groups of people. So as researchers, we have to be creative in how we address some of the challenges and the barriers that may limit the involvement of a diverse group of people. So this means not only in your participatory approach, so say if you're doing a Delphi process to come up with consensus around a research decision, and you want to engage people with low literacy or language barriers, the information is going to have to be provided using maybe visuals or allowing conversations. So changing the way you do things to meet people where they're at is very important. But this also means your recruitment method. So how are you going to make sure everyone learns about the opportunity as well? Yeah, and I think I've gone through that. And making sure you address all of those. So when you're thinking about recruitment, first of all, it's important to think about what motivates people to become involved and what are the variables that actually impact people's motivation. So first of all, time and energy commitment that's required. So giving back to the community, having a say or having my voice be heard about a specific health issue, may be sufficient motivation for patients and the public if the method of engagement requires kind of a finite amount of time. So one meeting, a 2-hour meeting in the evening, a one-time kind of discussion group, that can be understandable. But the more intense the level of participation that you're asking for, so ongoing engagement on a steering committee or on a research team throughout the entire research process, the more the barriers to engagement are going to increase, right? So when you think about it, people have to have time to go between healthcare appointments, they may be raising families, they may have work to go to. So that means the higher the level of commitment that you're asking people to give of their time, the increased level of motivation they have to have in order to engage. And then when we talk about interest in the research topic, it can be quite empowering when the research topic is actually relevant to the personal journeys and life experiences of patients and partners and speaks to their values and aspirations. That's why it's usually good to have conversations with people ahead of time. It can motivate people to be more involved or to stay longer. But when subjects are really abstract, when we think about like those larger health system and health policy kind of questions that as healthcare researchers or health policy makers might be totally into, or healthcare professionals, patients and members of the public who may not be as interested in it. So this difference underscores, again, the importance of engaging patient partners earlier in the stage so that the research question reflects a little bit more of what people may be want to come into. And then again, the participatory approach that you choose may affect motivation as well, because it's important to understand how people want to be engaged in health research and what type of participatory approach is going to allow them to fully be engaged, and whether they feel like their voice is actually going to be heard. So it all depends on those things. And so some of the things that we know, we've heard from people around what motivates them to become involved. When people say your involvement in this health research project will help people, like communities living with a health issue, will give you the opportunity to give back to the community, will aid in working towards improving the quality of life, not only for yourself, but maybe a loved one or a member of the community, will assist in improving the quality of care and the services, not only for yourself or your loved ones, but also others, or else it gives you the opportunity to contribute your valuable insight and perspectives on this important health topic. So think about how you want to frame this opportunity to speak to some of the aspirations and motivations of patient partners as well. But you have to be careful as researchers that you fully commit to whatever you are delivering on what you're framing this as, right? To potential partners. This framing sets everyone's expectations on what's going to happen in the research program. So don't overpromise if you're not going to be able to. So there's many, many methods to start doing recruitment. Once you've figured out your participatory approach, the way you want to engage people, then you have to start thinking about the ways in which you're going to reach out to people. Oftentimes it's building relationships with healthcare consumer organizations and having them help you spread the word, help you identify partners. And also they're going to also asking different community organizations about what the best way to engage people is. And so healthcare consumer organizations can not only help you with the participatory approach that you choose, but also the recruitment process and spreading the word and identifying people. Sometimes people like to also do multi-pronged, so on-location advertisements in different healthcare services, whether it's clinics, whether it's hospitals, those boards, the electronic boards, sometimes in waiting rooms, you can get an advertisement out there. Also partnering with healthcare professionals. So sometimes you might have both healthcare professionals on your team, talking to them about what would be the best way to identify potential patient partners, what's the best way for healthcare professionals to be able to not change around their day, but be able to ask about whether someone's interested in the project. Also health researchers, so people who research in the same area as you, who have engaged before, maybe it's talking to them about whether there are patient partners that they know of that might be interested. Online forums, there are tons of online forums out there where people with lived experience have conversations about things that are important to them. So there's sometimes opportunities to engage a moderator and say, we have this opportunity, is there a possibility that you can talk to some of your community members about their involvement and whether they would be interested in something like that. There's Facebook community pages. There's lots of things going on. I know for research around pregnancy, mommy forums are insane online, and there are lots of opportunities to kind of get diverse perspectives that are chatting online. Local newspapers are sometimes one of the best ways. I know here in Manitoba, our regional health authority, when they do the local health involvement groups, they put a little ad in the Winnipeg Free Press. So sometimes sometimes in smaller or remote areas, those little newspapers are the greatest for putting a little advertisement in. Connecting with leaders at local community organizations. So I always say if you want to get diverse perspectives, going outside the healthcare consumer organization to start talking to whether it's women's organizations, LGBTQ, Indigenous, immigrant and refugee resource centers, clinics within here. So talking to people who may be outside of the healthcare sphere, but they might be able to help you identify ways in which to engage people and people who may really be interested in the subject matter as well. So healthcare consumers, of course, e-newsletters and websites they can post it to. When you think about doing email blasts out, one thing to think about is not everyone has internet access, so also mail-outs might be a kind of twofold approach within different communities. Sometimes it's attending events, it's going to community events, having a little information kiosk about your research project, going to community dinner or feast, talking to different members, engaging in different, street parties, those types of things, to talk to people and engage people about your project, tell them a little bit about it. And some rural and remote radio spots are one of the best ways to get your word out to people, because the local radio station is where you get all your community information. So putting out a spot on the radio as well as TV spots, breakfast television, and those types of places are always looking for unique kind of things to talk about and address. So you could get on breakfast television, talk about this opportunity and this research that you're doing as well. And then, of course, there's sometimes health consumer support groups, organizations that you can ask to come in and attend. I think we've had projects where, a cancer support group has very much been interested and wanted somebody to come and talk for 10 minutes about the opportunity in the project. And so these are different ways to start thinking about recruiting. And it's big about thinking about who all your potential partners are that can help you to recruit. So beyond healthcare consumer organizations, thinking about healthcare professionals, local community groups, health researchers, also PE, so patient and public engagement, people like myself. So every support unit across Canada has a patient partner or a patient and public engagement person within their support unit. There's also all the national networks like the Chronic Disease Network and so on that have patient engagement people that you can talk to. You can send them an email and say, do you know what the best way to identify someone is, or do you have someone that you think might be interested as well? So talking to people in that area as well. There's also patient consumer lists. So there's patient voices. There's a national patient group as well that you can potentially post or call out to as well. And then actually talking to members of the community is one of the best ways. The number of times where I've done discussion groups where it was actually all word of mouth, where I invited a few parents and then they started talking to some of their friends and coworkers, and all of a sudden I had a huge amount of people. So word of mouth is good as well. Asking people what voices are missing. Who do you think I should be talking to? So the tips and tricks is ask people, talk to people, community leaders, elders, talk to people with lived experience and say, who's missing right now? Like, I feel like I'm missing some people. How do you think I can reach out to them? Or do you have anybody that you think you could reach out to? So empowering people with lived experience to engage their peers can be an effective way, especially to overcome a lot of barriers to participation, including things like language barriers, trust barriers. By having a peer, it helps build that relationship from the beginning. So again, going beyond healthcare consumer organizations, talking to local neighborhood groups, having conversations, going for a lot of coffee and tea with people, and just talking about your project and ways in which you might be able to talk to people about it. Healthcare professionals, one thing you have to be sure of if you have a healthcare professional on your research team is using participatory approaches and addressing the fact that patient partners their engagement in the research project, no matter what they say, no matter what they do, will not affect their care is a huge one, right? Because that could be a concern for partners in becoming engaged in the first place. Different mediums, we talked about different ways to get your message out. It's important to try more than one, so not just doing an email, but try different opportunities. Make sure that your recruitment strategy is balanced and inclusive. So try to involve people with lived experience in helping you develop your recruitment strategy. It's an important way as well. So get people's perspectives on what's the best way to talk to people and reach out to people. Oh my goodness, this one's a funny one because I often ask researchers to send me a lay summary of their project. When they ask me, do you know anyone interested? Make sure your message is simple and that your expectations are super clear. Because you want to, no jargon, no acronyms. You want to briefly describe the purpose of the study, the objectives, why you want to engage people, compensation, those types of things, whether there's online training requirements, what the expected roles are, what are the expectations, all of those things. Think about it in very clear language. So oftentimes when people say, can you do a call out to, so I have different advisory groups that I'm in touch with and different people, can you do a call out to your people and see if anyone's interested? Here's some of the stuff that I'm gonna ask to get before I do that. What's the project about in lay language? Who are you looking to become involved with, right? So specifics, if it's women between the ages of 15, let me know specifics about who you're looking. Tell me what some of the benefits are in becoming involved in this project. What will people get out of being part of your team? Are there additional things, you're going to get to learn a little bit more about the process, or maybe a healthcare expert will come to one of the meetings and answer some of your pressing questions. So different things, or maybe it's meeting other people who are going through the same experiences. What are some of the benefits? What's the time commitment? And when I talk about time commitment, not just the meetings, but think about the prep time that it's going to take to attend these meetings and to contribute fully. Think about if you want them to do some training ahead of time, include that in the time commitment so that you're being completely honest and transparent. What level of engagement are you really looking at? Are we looking at just obtaining feedback, or are we looking at full shared decision making? And then, is there compensation for patient-public partners? So compensation, not only like an honorarium or something for their time and their contribution, but also thinking about, there'll be childcare available, transportation will be covered, parking fees will be covered, those types of things as well are super important. And it actually, including those things in your recruitment call out is going to help in the long run, because that means people who might be hesitant to attend because, I have kids that I need to look at. By addressing some of those barriers to engagement in your call out, you might attract more people. Sometimes if there's a longer, so if you want a longer commitment, like an advisory group, you're going to maybe want to also include a role description with your call out, or have it somewhere accessible online, but also make sure it's in different formats. So also be accessible to talk about the role description with someone as well, or have them so they can read it at different multiple formats for people. So in your role description, you're going to want to address things like what the research project is, what the participatory approach is, what the role of patient-public partners are going to be, time commitment, what are some of the responsibilities that they're going to be handling, right? If you're going to be asking them to do some major stuff, you want to be sure. When I say competencies, I do not mean research competencies. I mean competencies around things like is open and curious, is interested in learning more about healthcare systems, is used to working collaboratively on teams where we don't always agree, I've had researchers sometimes come to me and be like, can you just find somebody with diabetes who has a PhD and bios? No, when I'm talking about core competencies, I just mean those types of almost qualities or attributes you'd be looking for someone to engage. Again, list some of the benefits of engagement. Sometimes we do stuff like we offer letters of reference for people. We offer possibilities for going to conferences or doing some training or doing things that they're interested in as well. And then contact, you want the person to be available not only by email, but by phone as well. So people communicate in different ways and feel most comfortable in different ways. If it is a long-term commitment, like an advisory group for many years, you may want an application form as well. Again, make sure your application form, if people don't want to fill it out, but rather go for coffee, you can do that for your application form as well. Their contact information. Sometimes I like to always talk about equity issues. So how, if you feel comfortable, how do you self-identify? Why you're interested in the project, what type of experiences you think you bring to the table, some of your skills, and then again, what your availability is, your accessibility, and any supports you might need. And sometimes people ask for references as well, and it can be personal references, it can be community references as things go. Sometimes we do interviews or coffee chats with potential advisors. And we just outline things like, here's some key things that you might want to know about the project. Tell us a little bit more about yourself and why you're interested. Tell us about experiences and skills you think you bring to the table. Have you been involved, and it can be involvement in any type of different, like, have you been involved in an advisory group before? What did you like about it? What did you not like about it? Open to learning new things. Do you have an interest in this? What are some of your special hobbies or interests? What kind of unique things do you bring to the table? One thing I will say right off the bat and to address as well is people shouldn't feel pressured to share more than they're willing to share in these types of things. Yes, we're asking for people's experiential knowledge in a research project and research decision, but no one should feel pressured to have to share all of their information. Yes.
Thank you. I was just going to ask, some of these questions maybe already be explaining to folks, like who have that ability to answer these questions in the appropriate ways.
Definitely. So these are kind of those engagement ones, those longer term ones, but I think for like
I get it.
Community-based participatory.
Okay.
Yeah.
Sorry, I just putting it in context.
But it's very true. If we sometimes maybe it's more just having a light tell me about yourself. Let's have a conversation about your interests. But that is true. If you want a lot of different perspectives, even on an ongoing advisory group, maybe your questions to be changed, not sounds like interviewing.
Well, yeah, it's, maybe some of the people you recruit are more of these like champion patient advocates, and then others are the ones that don't have that ability to be the champion, or they're like, I don't know.
And sometimes you might, I know what a lot of times what we're saying too is, so if you want to engage youth around outcome measures that are most important to them, it might not even be sitting on an advisory table or sitting on a research team. It might be going and doing an arts-based project or cameras or videos, go around your community, take pictures of outcome measures that are most important to you. And those processes, you wouldn't need an application form. You just do a call out and say, who wants to run around and take some pictures for the day, right?
Right. Okay.
Those kinds of things. Or are you really passionate about it? And in those cases, I would definitely as well. Or let's have a big dinner together with community members and just talk about health research. These are only just suggestions if you're going the full kind of route. I know with like CHI has an advisory group that we give us about. Oops. And just talking about different supports that might be important for people to carry out roles. So what kind of things that might you need? What kind of stuff do you need from me to be able to fully contribute? and those types of questions, double checking availability as well. So the checklist is, first of all, I always say the earlier the better. So engaging people from the very, very, very beginning is very important. So talking about priority setting and those types of things as well. Having coffee with people, having conversations before you even hammer out anything is really important. Being accessible, it takes a lot of time to build relationships, so that means you need to be available to go for coffee, or Trish knows to go for pad thai. and depending on how people engage, sometimes you're going for coffee and talking about, what do you think about this consent form? Like, so it's different ways of meeting people where they're at, to ensure and making yourself available, as to have a partner text you if they feel comfortable, or email you with some of the concerns or questions or things that they need to do. And same with social media, maybe you're online communicating with people as well. Making sure, again, to choose different inclusive participatory approaches, like the youth and the photo, like different ways of engaging. And hopefully, when you talk to people in the beginning and find out how people prefer to be engaged, some of that stuff will come out to help. Safety first is always my biggest thing, and we're going to have a chat about that next time, but just to say that discussions and check-ins around safety aren't a one-time deal, especially on long-term projects. Making sure that it's an ongoing practice throughout the process. So talking about not only the meeting space that we choose to meet in, so a lot of times there may be experiences of trauma within healthcare systems and universities. You may not want to meet in places that are out in the community that feel more safe and also accessible to people, but also having those conversations around what safety looks like to me, feels like to me, means to me, and building common guiding principles as a team around how we're going to ensure that one another feels safe when we're interacting. And if there is a conflict, that we're going to be able to actually say, wait a minute, and challenge one another as well. Ensuring that people feel secure and feel supported as well. So if English isn't the first language, you need to make sure that you have proper things in place, interpreters, translators, visual impairments, making sure you have visual aids or equipment, hearing impairments, audio aids, physical disabilities, understanding mobility issues, and whether there's a care attendant or people who need to be present. And fair once again, I'm huge on fair compensation for the time that people put into things, because a lot of times researchers or healthcare decision makers or policy makers say, well, I'm not getting paid to be in part of this project, but in a way, indirectly, you're trying to advance your career and leverage your earning power. So there is something that's coming out of that. So it shouldn't be expected that community partners volunteer their time for the project, and thinking about all of those other barriers as well. And also, if people are part of your team or conducting the research, making sure that they have all the same resources at their disposal that you do. So perhaps an office space or a meeting space, a printer, a computer, a scanner as well. You shouldn't expect people to be doing it all at their house, so printing things off or scanning things or using their own equipment. So just thinking about all of those spaces to make people feel supported. These are just some tips and tricks, and there's lots more, but are there any questions? No, they've gone. Are there any questions online? Yes. I can let you guys know about the next Lunchtime Learning series. We are bringing an oldie but a goodie back because not everyone has and we've had requests about this one. So we're going to talk about the importance of a trauma-informed intersectional analysis when you're developing your patient publication strategy, and the importance of those types of practices. So that is December 12th, Wednesday at noon Central Time. And yes, if there's no question, Dylan.
I have a question.
Yes.
So just when you're writing up an application to do this type of patient engagement, and you just talked about how there's going to be pragmatic and have like 15 different ways to engage people and stuff. And the project, since it involves people, likely have to go through RED review, right? How do you cover off all of those different things? And like you just keep writing them, or like is it going to do a survey or groups, that kind of stuff? That should go to the UM RED before you interact with patients in public. So how does that get written up in the protocol? So I've been trying to do that, and it's just like semicolon, or this, or this, or this, or all of this, and then I was wondering about feedback on the reviews. And I guess where you need to or not, because at what point in the participatory approach does the patient or public become an investigator, and then you don't need to get ethical oversight for all of your interactions. But obviously, at some point, and I would imagine, you have to kind of approach them, recruit them onto the team, without them at some point being not a team member.
Okay, so those are a couple of different questions around ethics. And it's interesting, I was just thinking of knowledge translation ethics. Oftentimes we have to say, we're going to engage end users, and the KT strategy could be X, Y, Z, like a bunch of different possibilities, because you have to remain flexible. So it does happen as well with engagement. Is we're going to talk to communities. We had to make a ton of amendments when we engaged healthcare consumers, and different organizations did discussion groups, other organizations did one-on-one interviews. We switched it around. There's still a lot of conversation around ethics, because there's a difference between partners and participants, and that is still one of those lines that I think ethics boards are struggling with. CIHR is coming down with guidelines around ethics for patient partnership, because they are oftentimes people with lived experience are on your team. And so then when they're co-researchers, I still advocate that there are things in place, because what if you have a person with lived experience conducting research that may be triggered by something that their peer has said when they're doing a qualitative piece? So making sure that you have supports available for your partner is important as well. Amendments is going to happen a lot, I think, in your process, especially if you want to be responsive to what people and how people want to be engaged. Being open about that you are going to have to use flexible approaches, and that it is about what is best for community. The thing is, it's not like engagement is something brand new. Like social sciences, Indigenous research companies have done community participatory research action for a long time, and so I think just some of the ethics around in health sciences are still happening with some of the issues that may have already been addressed. I know with some of the ethics guidelines that have come down, there was a recent article about this, that if it's partners, it doesn't have to go through RED. If it's participants, it does. But there are those gray lines, especially if you're doing community participatory action where the partners are participants and it's a cycle. It's best to go through RED. I think Shelley gets a lot of, here in Manitoba, I think our ethics person gets a lot of phone calls probably. I think in all of our projects have usually sent an email or a phone call. Do you think we need ethics for this? This is the situation. They're partners. They're not participants, but yes, they're doing this. Then oftentimes they're super responsive, I find, usually in asking those questions. But with both engagement and KT, a lot of times it's a lot of different approaches that are going to have to be dependent on the people you're engaging, and you might not know. It's good to engage people at the very beginning, because then you'll have a much clearer understanding as you develop your entire research process of how you want to engage. Usually that's a really important. Some of the challenges, for sure.
I just had a tip that locally in Manitoba, they have that coffee use.
Oh.
That actually led to way more participants for my supervisor's study in the community, so coffee news. Because it's cheap to put in there and it's at all these little restaurants and all these little creamy
There's
asphalt.
also wellness. Almost exactly the same.
Okay.
And they're super nice.
Yeah,
Also quite good.
Okay.
So coffee news, wellness news, and I'm sure for people in other places, there's those types of local things as well that are in coffee shops.
Mm-hmm.
Those things you pick up.
Just a comment on the different recruitment techniques. The TV and radio for recruitment generally, you can get it for free, you can get on it as content.
Yeah. But
generally paying for it is not my experience in numerous different projects, not particularly good. So the TV jingle, or like a radio jingle, is not very good for recruiting for a project.
No.
It's sort of like brand recognition and thinking of a product, but they have to hear it multiple times and they wouldn't be able to pay for it.
Yeah, and PSAs are quite expensive
Yes.
to do in the first place, but oftentimes you can pitch a story to a journalist or a reporter and say, I have this really interesting thing. Do you want to I can come on and be interviewed, and oftentimes that might attract people, and especially really small remote community where the radio station is at. But breakfast television too. I don't know why.
Journalists are always project.
They're looking for interesting stuff, and especially where community is being asked to be involved. Any other questions?
Can I just come back to the ethics piece? So
Yeah.
is your recommendation simply that we call Shelley Russell? Like, is that?
I think if there's ever a gray area where you're not sure around whether you need to apply for ethics, typically if you're involving people on your research team at the very beginning, I know that they don't need to start doing it until later on.
So let's say, can I give you an example? So, because I don't even know if this is gray or not. Yes. So it doesn't seem to me like it should be, but I community in Manitoba. So, for example, there's a study where we're not really sure what are meaningful patient indicators if we're going to measure the quality care given to them, to this group of people. The clinical indicators have some problems from a stigma perspective, and so we want to talk with people. That's our sort of first piece. It's more consultative than it is. But some of them will go on to be on advisory board, of course. But the first piece is just help us design, help us figure out what indicators would actually mean that you're being hired for.
So helping them design those things.
Yeah.
How would you say? I mean.
Trisha's the more cautious of the two of us.
I would always recommend if you're unsure to include it. I mean, there's, in terms of, the point of ethics is to avoid doing harm, right? And to do things in an ethical manner. So if you are going to include people, there may be issues around how they're involved, or, any potential ethics that could come up. It's not going to be harmful to you to include that in your ethics commission and say, this is the process we're planning on taking. If they decide that, okay, you don't need to, have a consent.
So we're not building this into a larger project. This will inform the grant that goes in. Right? So we're not the point of applying for ethics. So I'm like, am I applying for ethics for this, just this very specific thing? That's what I'm. I understand it.
Yeah. And that's some of the challenges with our PE award winners. So we have a patient public engagement award here, and typically it's to engage people before the grant application.
Yeah.
And I know I've talked to Shelley, she's kind of been like, okay, I don't want to see people before they've even got the grant. So, yeah. But
I mean, if you're not required to submit ethics, then if you're not doing a study, right? But I'm really not sure, and I think in terms of where we are with health research and ethics, that's something that still needs to be worked out and addressed. I don't know if it's at an institutional level or provincial level or national level. Like you were saying,
CIHR is coming with ethics guidelines. They talk to their ethics committee as well as some of the POR, the patient-oriented research committees.
around this topic, because if you're wanting to engage people on your research team for partners, not participants, if they're forming a research decision versus being studied,
Because when it turns into a participant, sometimes people want to study the engagement process, and so then they're transcribing and and then it's essentially you're collecting data, has their participants, has personal RD. It's where you're having those coffee conversations with people around indicators that are most important to them to do your research design, where there's an open or the gray area. Again, maybe that's where just talking happens.
That was exactly the scenario for the question. And so with the PE awards
Yes.
that I was part of the last one, that I put in REB applications because they were either focus groups or individual interviews with patient populations, and we were collecting some type of data, like their answers are being, they said, this outcome is most important to me, that's being recorded. So I think if you had a conversation and there was no data collected and it just went into your mind as a researcher and you brought that up later and said, I heard, but then someone might say, well, how did you hear? Like, what's the evidence for that? And then that would be something that you get a grant application would love to know. So my choice as a researcher is I went and wrote up a protocol, and amazingly time consuming to do all this.
This is what I'm concerned about.
I came up with a set of questions that I said would be asked or discussed in an open-ended fashion, in either recording or transcribing, and we would look at what came up the most. And then from that, we build a survey, and we asked other patients to fill it out sort of anonymously or whatever. But then you can actually put that in your grant and say, this is definitely from people who have chronic kidney disease. Otherwise, you're missing that step in the grant application, potentially. And that's just from my academic from the REB had. If you're asking people something, and they're not participants, they're not researchers yet, they're participants. You're asking them questions. Like,
But they're co-designing a study rather than.
are they co-designing
Well,
the study?
they're having input in design.
Well, at the very beginning, you're taking their information. They're not, the first approach, they're not co-designing a study.
No, they're co-designing indicators.
Well,
piece of the
they're-
So this is where, I mean, I'll talk to Shelley, because I actually follow, I mean, I totally understand the ethical concerns about how you would do this. You're talking about a sensitive, right? And the vulnerability, like all of the power issues remain, but the actual, like, a larger group of people are being asked to do this, and those that find this interesting and want to continue will be then joining the study as partner, you know what I mean? Like there's anyway,
I really wish it wasn't, but in my mind, I sort of picked it like it is, because you're approaching people to give input on topic, and that's like moving them into the focus group for the survey.
Yeah.
Alex had something to add.
Yeah.
I just want to follow up. And you can formalize and imagine those results. Make it sense.
The CIHR's guidelines on this going to cover this
they're supposed to cover those ethics areas.
this kind of stuff exactly, because I went to look for guidelines for it, and I was like, I wish someone would write these up. When do we start? Like, I wish the REB had like, this is exactly where you need to start if you're going to do this, but it's not there.
It's still from what I looked at in the UK and other places, they say partners don't require ethics. PCORI's the same way. So it's that differentiation between participants and partners, but we also see an increase of we want more evidence around patient and public engagement. If you're wanting to do any type of publication afterwards around how you engage, then they are a layer of
Yeah, in the journals will say, even if the two, right? Yeah. But if you aren't, then you put publishing.
and you just want to
Then it's
co-design
yeah.
It's always easier to ask for permission than
Yeah, no,
generally speaking.
I understand that. I just, it's a big, it's a good.
And I definitely disagree with the reverse, because you want to ask permission and not, forget forgiveness, when it comes to ethics.
Yeah.
And all things.
Ethics for
Well, maybe I'll sign off for now. Thank you so much for everyone coming today. Lots of good questions and conversations.
If you haven't signed in, please just add your name to the list.
Thank you.
Um,